physiology. You need to understand numbers and stuff, but it's got much more of a business aspect to it than actually the patient care kind of an aspect. We also offer a physical therapy assistant program. You might have all, if you've ever had a sports injury or anything like that, you might have seen a physical therapist, a person that's going to help you regain your ability to get back to normal. You get your muscle strength, help your joints improve, mend your broken bones, whatever that may be. A physical therapy degree right now takes what's called a clinical doctorate. It's 4 years of college, 2 years in a master's program, and 1 year of clinical expertise after that. So it takes a good 7 to 8 years to become a physical therapist. But a physical therapist, if you think about it, when they're working with a patient, can't be with every single patient all the time. They're there to determine exactly what you need, what exercises you need to do, how often you need to do them, what kind of follow-up you need. But they need somebody to help them actually make sure all that happens. So a physical therapist assistant is that person that makes that happen. They're the one that actually works with the client every time they come in for their exercises or their therapy, their water therapy, whatever that might be, and works with them individually. A physical therapist assistant degree is an associate degree. It takes 2 years right now. I'll be honest and say that in the very near future, it will be moving toward a bachelor's degree because that's what the accrediting bodies are expecting us to move to. We're making sure of that, but right now you can get in and get out within 2 years. Starting pay is anywhere from $48,000 to $52,000 a year, Monday through Friday, no weekends, no holidays. One of those great kinds of schedules that allow you to still have a life. It's an interesting career because you're working directly with patients, but it's much more on a rehabilitation. You want them to get well, and you want them to get back to normal, and you want them to be able to function or play football again or whatever you want, your particular areas. So it's a very rewarding kind of career as well. But it takes a great deal of knowledge in anatomy, physiology, physics, math, and all those kinds of things, and how that all interrelates. We also have a radiology technology career, which is a 2-year associate's degree program to be an x-ray technician. If you've ever broken your arm and you've had to get your arm x-rayed at the doctor's office or at the clinic or something like that, it's the x-ray technician that has to determine exactly what needs to be done, what the machine needs to be set at. It's pretty complicated. Surprisingly, it takes a lot of physics, which I'm not a big physics major, but I was astounded the amount of math that is involved in something like that. But it's a very rewarding career that you can get in and get completed in 2 years. You can go on, and at the same time you're taking your radiology technology classes, take medical imaging classes. Medical imaging would get you a bachelor's degree then and allow you to do more complex kind of radiography. That's mammograms, ultrasounds, sonography, those kinds of things. So you get a good feel for that whole area. And it allows for, even advancement past that because there's much more specialized areas. There's cardiac radiology where you're helping a doctor do the intricate cardiac exams where they're, running isotopes through people to help them to visualize how blocked their arteries are in their heart and stuff. So it allows for lots of different options. And we offer, like I mentioned, a lot of different programs that really try to stay specialized, though, so that we're really good at what we do. We don't want to be branched out. We don't want to be, a college that's so large that you get lost walking down the halls kind of thing. But it really allows for people to get out of school and get a job right away and really function well in their job and be really prepared for their job. That's one of the biggest things we hear back from the facilities that we help place students at in their jobs is that they really feel Clarkson graduates are folks that really know what they're expected to do and they're able to do it once they're out there. So there's lots of places to start, lots of things to think about, and I would encourage you now that you really need to be looking at the fact that what you're doing now makes a big difference. The kinds of classes you're choosing, the kinds of things you're studying will really make a big difference. You don't want to have to be, playing catch up once you get to college. You need to try to get as much prepared as possible. Okay, I've talked enough for a few minutes. What kind of questions do you guys have? At all? Nothing? Yeah.
What puts you guys, like, aside from, like, Methodist College?
We're really comparable. We're both private, nonprofit institutions. Methodist College, of course, is affiliated with Methodist Hospital and the Methodist Women's Hospital, and we're affiliated with Nebraska Medicine. And that, you really kind of have to start from those affiliations. That's historically how healthcare colleges started. They actually started in the hospitals. Methodist offers a few other career programs that we don't offer, and then we offer some that they don't offer. But really, we don't think of them so much as competition, but they are very, very similar. And it's really hard to say. I mean, I think they're a great school. I know a lot of people that work there, and I don't have anything bad about them say. I would hope they'd say the same thing about us. And part of it is the fact that with their affiliation with Nebraska Methodist, they have those clinical sites available, and we have a lot of the Nebraska Medicine clinical sites available. You know, really, other than that, there's not a lot of big differences. Does that answer your question? Yeah. The difference that a lot of people always ask is between us and UNMC. UNMC is the Nebraska University system. They are a college just like UNL and UNK and Kearney. They just happen to have all of their medical career choices mainly here on the campus in Omaha. They do offer nursing classes at their unit in Lincoln. They have to end up coming here their junior and senior year. But it is a state-supported school, so their tuition is lower, obviously, in any kind of state-supported system. And they have different admissions requirements. Their programs are slightly different. Like, for instance, their nursing program is the one that, for the first 2 years, you take general education and kind of general kinds courses, and you don't start working with patients until your junior year. So you've got a big gap there of time. I personally feel that's a disadvantage to the students because the longer experience you have working with patients, the better practitioner I feel people are. But that's just, the way they run their program. Yeah. There was another question. Yeah.
For one of those nursing aid classes, is it usually like 16 to 18 or like actual college students?
Yeah, that's a good question. She asked about the nurse aid classes. For a nurse aid, you just have to be 16. You do have to be in good health and condition because you are expected to be able to lift 50 pounds if by chance you had to help assist lift a patient. But otherwise, there's no requirements of being, you don't have to have graduated from high school or anything to that effect. For the medication aid, you do have to be 18, and that's a state requirement. And with the nurse aid class, right now, for instance, the daytime classes are Monday, Wednesday, and Friday, and it's from 8:30 to 4. The evening classes are from 5:30 to 9:30, 3 nights a week. And so you get done relatively quickly. Once you're done with all the classwork, like I mentioned, you have that clinical, which in the daytime it's just 3 days, and in the evening it's 4 nights. You go to clinical with an instructor, and there's like most 10 students and the instructor. And then you do have to come back to the college, and you do have to take a state examination. There's both a written examination and a skills exam where you have to demonstrate the skills you learned in class to the instructor and get checked off on those. Those are all required by the state of Nebraska, and mainly because they want to make sure that anybody working as a nurse aide out there is really qualified. And so we provide all of that as part of the class and really feel we prepare people for those examinations because that's part of what our job is, to make sure you're going to be successful and know what you need to know. So all of that takes place in the daytime class. It takes about a total of 6 weeks. In the evening, it takes about 2 months to get it all taken care of. But that's a good question. You had a question?
How much do those classes round up to be? How much they are?
Yeah, the nurse aid class is $495, which includes the textbook. The only other thing you need to have for the class is you need to get a tuberculosis skin test done, which we provide you with the information to get that done for $10 at the Nebraska Medicine offices. And then you need some type of navy blue nurse's scrubs for the clinical. You can borrow those. We offer them at a discount if you want to purchase them through one of our suppliers. you can buy them at Walmart. It would maybe cost you another $40 or so at the most. So I tell people roundabout it's about $550 altogether for what you need for class. The medication aid class is $325. That includes the textbook, and you don't have a clinical or anything, so there's no other supplies or anything that you need. But those are good questions. Yeah.
And what's about the starting pay for a nurse aide?
Nurse aides right now, because there's such a demand, are about $12 to $13 an hour, and some places it's even more if you're willing to work weekends and or nights. And it really depends on the size of the facility and the kind of job. Now realize that there's some that, like in long-term care facilities, are relatively entry-level positions, and so they're either casual or part-time. They do have some full-time available if you're, interested in that as a full-time position. There's a difference in what you're actually asked to do. Like if you work at Nebraska Medicine as a patient care attendant or a patient care tech, those nurse aides do a lot more complex procedures. They do a lot more work, and they get paid more for the advanced level of what they're doing. But it's a very, set. Those folks work 12-hour shifts at Nebraska Medicine. So to work full time, it's 3 days a week, and that's it. Yeah.
After you completed the class, would you be able to work part-time while you're in college? And then
Very much so. A lot of the nurse aides do, especially once they're, like our students, they do our nurse aide program, get admitted to the college, and then are able to work at Nebraska Medicine. When they start working there as a patient care tech, that's when their seniority starts. So if they go on and graduate and then get hired there as a nurse, their seniority has started from the day they started as a patient care tech, which really is beneficial for your time off, your retirement plans, all those kinds of benefits that you get, because it all makes a difference from, how long you've been there. But yeah, we have a lot of students that work as nurse aides while they're in school. And it's not necessarily just the nursing students, because we get a lot of students from other career paths that take the nurse aide course as well. Like I mentioned, get a lot of the Creighton physical therapy students and a lot of other folks that are moving into those programs that want that kind of a job to get some experience while they're in school. And most of the facilities are very eager to have students. Any other questions? Those are good questions. I would since you guys got this, you've got the luxury of having this class and being able to explore all those kinds of these areas and understand some of the nuances of what the different jobs take and what kinds of things you'll be doing with the jobs and stuff. I think it's an important opportunity to take advantage of this, because there's a lot of folks that don't have this opportunity, and they're kind of blind when if you haven't been in healthcare or you don't know somebody in healthcare that you can talk to about it. I would urge you, if you get a chance, to many of the facilities. I know Nebraska Medicine offers a shadowing program where you can sign up and follow somebody around for a couple hours just to see what does a respiratory therapist do if you don't really know. A lot of the schools, especially Clarkson, offers a lot of opportunities to come in and tour the campus, sit through a class, talk to the faculty, really sit down and look at what kinds of classes are you going to have to take. What are you expected to take? We offer we offer our own general education classes, English and those kinds of classes, but many of the programs, because the amount of healthcare information, the amount of patient care information that you have to know, there's not a lot of opportunities for electives. So if you're thinking of you really want to take some art classes or pottery or something else in college, you're going to really need to look at a larger school like UNL, UNK, someplace like that offers you those opportunities. Because the smaller programs like ours or Methodist and that are going to provide those kinds of opportunities. We do have a lot of on-campus activities. We offer yoga and all those kinds of things, but we do have some intramural volleyball and a few different sport leagues like that. We don't have some of the bigger sports programs like College of St. Mary's does or something. But so you really have to look at what your particular interest is and what kind of school you're really looking at. It really makes a difference to go there and walk around and meet people